Listeriosis is the name given to the disease that's caused by a bacteria, and the bacterium's name is Listeria monocytogenes. But we call it listeriosis just to keep it simple. So pregnant women are at the highest risk. Other risk groups include people over the age of 65 and anyone that has a weakened immune system. In our population, an important group is those living with HIV and AIDS, but other people that have cancer, diabetes, and underlying liver or kidney disease are also at risk. Very young babies under the age of a month are also at high risk for severe disease, but mostly when they get infected while still in the womb. People who develop the severe forms of the disease will tend to be extremely ill. And as part of the investigation that a nurse or a doctor would ordinarily do for someone presenting that ill, laboratory tests would be done. And this would include taking a sample of blood, and in the case where patients may have signs suggestive of meningitis, like for example a severe headache, sensitivity to light, confusion, then they may also take a sample of what's called CSF, and it's the fluid that's around the brain, by a procedure called a lumbar puncture or a spinal tap. That is also sent to the laboratory. Then all laboratories countrywide, in the public sector and the private sector, can easily diagnose listeria when they perform tests on these specimens. So listeria is treated with an antibiotic called Ampicillin, and this is an antibiotic that's routinely available at all public health facilities throughout the country. So it's a cheap antibiotic, as I said, available at all healthcare facilities, and all patients with listeria should be treated with this antibiotic. Sometimes a second antibiotic called Gentamicin is added, and again this is an antibiotic that's widely available at all facilities. The treatment is usually given for at least 2 weeks, but maybe longer, and it depends on how quickly the person responds to the treatment and how severe the infection was to begin with. So because we are particularly concerned about meningitis due to listeria in high-risk patients, and this includes very young babies, people with underlying risk factors like weak immune systems, we have advised doctors and nurses throughout the country to include this ampicillin antibiotic when treating patients with meningitis, even before they know what the cause of the meningitis is.